Good afternoon, everyone, and thank you for joining me today for our webinar on preventive care billing in the FHO. Our presentation today will go through all the aspects of your preventive care billings and give you some tips and tricks on what to look for and what to be aware of when billing for it and calculating and just your overall process throughout the entire year. This presentation will be recorded, so if anyone has to leave early or if anyone had a colleague or staff member that wasn't able to join, we will have a recorded version, so not to worry about that, and we will be able to send that off to you. We will do a follow-up with each of you after the webinar, so if you are interested in the recording or getting some more information, please do let us know at that time, and the same goes with questions. Please do write down all your questions, and I would be happy to answer them via phone calls or emails after the presentation. So let's go ahead and get started today. So the purpose of today's program is to provide you with a one-to-one support on how to bill properly in your preventive care bonuses and walk you through the program as a whole and give you a little bit more on the billing perspective at a high level. So preventive care bonuses does only attribute to about 2% of gross billings within the FHO model, but it is something that most physicians can achieve at a very high level, and we want to make sure that you are doing what you're supposed to be doing in order to get the bonus, because chances are you are providing the service, so we want to make sure that you are getting the bonus appropriate to the level that you are achieving. So some quick facts. You're eligible for about $12,800 in the bonus level, so for screenings and vaccinations. Average physician will earn about $8,500. Again, you are providing the care, just making sure that you guys billing it properly so you do achieve the bonus levels. So it's based on your demographic. So every physician is going to be different. Not everyone is going to have patients in each of the categories. Not everyone is going to have enough patients that are receiving the service in each of the categories. So it really is based on individual performance, and I always get the question, oh, how am I doing compared to everyone else? And really there's no answer for that, because every physician is different, every roster of patients is different, so you just need to focus on what you're doing and making sure that you're providing optimal care and billing appropriately for it. So again, for example, if you have mammogram, if you have patients, female patients within that age category, and you achieve 75% that receive a mammogram, you're going to get the bonus level of $2,200. And we're going to go through each of the categories and talk a little bit more about each of the bonus levels and how much is eligible at each point. So what are the categories? So we have Pap smear, mammogram, colorectal screener, which are in the cancer screening category. And then you have influenza and childhood immunizations, which are part of the vaccinations. And again, all 5 of them together are comprised of the $12,800, so it's not like you have to do one or the other. You're all eligible for each of the categories. Some a little bit easier than others to get. Flu shots, for example, used to be very easy to get. Now it's a little bit more difficult. And at the end of the day, you need to do as much as you can to get the patients to get the service or for you to provide the service to them, but if they don't want it, they don't want it. And in some cases, we have actually heard from the ministry that if you have proper documentation to indicate that the patient has been very adamantly against one of the services, and again, you have the documentation to back that up, you can actually remove them from the population. So again, we're going to tread lightly with that one because, again, with the ministry, you never know. They say one thing one day and then it's something else the next. But we have seen that. So if you do have a specific question about that, please let us know, and we're happy to reach out to the ministry on your specific behalf to see what they say on that matter. So this is our FHO billing guide, and this is what we call our orange side. So you have all the different categories listed there and the different bonus levels and exclusion codes and tracking codes. I know it's a little bit hard to see, but this is something that we do provide to all of our clients. And so if you are interested in that, please do reach out and let me know, and I'm happy to provide that for you. So what are tracking versus billing codes? Billing codes are codes that you're providing, that you're submitting to the ministry when you do the service. So you're going to do the pap smear, you're going to bill the G365, you're going to bill the E430 as the tray fee. That is, you're getting paid to do that service. A tracking code, the Q011, is in order to track the service. So let's say, for example, a patient has that pap smear done elsewhere. You want to track that it has been done. Obviously, you're not going to get paid for the tracking code, but you want to make sure that they are being tracked within your preventive care program, so you bill the Q011A. On the exclusion code, you want to bill the Q140A, so that's if they're not eligible for whatever reason. And the same goes all the way down. The only two that don't have exclusion codes right now are the influenza and the childhood immunizations. However, like I said earlier, we can tread lightly, but we may be able to remove them from the population if they refuse the service multiple times with written documentation. So the influenza vaccine in particular, so anyone on your roster 65 years of age or older, again, the tracking code is the Q130. So that's if they have received the service elsewhere, pharmacy, walk-in clinic, hopefully not, but you never know. So if you put up a sign at the front desk and ask patients if they have received the service and they let you know that they have elsewhere, you can bill the Q130A, and that will track it within your program. One flu shot annually must be performed before January 31st. Like I said earlier, no exclusion codes. And again, the challenges are people are refusing them more and more now. People are reading more about it. They're a little bit more apprehensive. But then on the other side, people get it and just don't let you know. So it really is important to ask as much as possible, both you and your staff, to ask the patient if they have received the service elsewhere. If you do receive 80% of your population that's over 65, you will get the full bonus of $2,200. Childhood immunization. This is a tough one because most physicians don't have that many patients, and if it has one patient, that is not going to get the flu shot or not get the immunizations, it throws off everything. So if you have 4 patients within that age category and one doesn't want it, all of a sudden you're at 75%. You're not even going to get the lowest bonus level. So something we do here is to really ask the patient's parents, obviously, which services they're going to like from you and which ones they're not. If they're not going to want the immunizations, don't roster them right away. Keep them de-rostered until a certain point, and then you can re-roster them at that point if once they're outside the age category for this bonus potential. So for the pap smear, females between 21 and 69, only sexually active. Again, we spoke earlier about the tracking code, the Q011, one every 3 years. And we want to make sure that we're billing exclusion codes also if they're not eligible for it. Cultural barriers is a tough one. We have a diverse population here in Toronto, and some people just don't want it for whatever reason. And again, if we can remove them from the population, it makes our life that much easier. So we're going to see how good we can do on that category there. And again, 80%, you're going to get the full $2,200. Mammograms, females between the ages of 50 and 74, tracking code of Q131A, one mammogram every 2 years. The exclusion code, again, if they're not eligible for whatever reason, we've listed those, 2 of them right there, mastectomy and being treated with clinical breast cancer disease. Q141A is the exclusion code on that one. And again, some of the challenges, although minor, patients being screened by OBSP, they don't always send you the report. You don't always know. You cannot bill or you cannot track the code if you just have sent them to do it. You actually need the report back to say that they have completed the service. Colorectal screening, both males and females, 50 to 74. Tracking code is Q133A. Service interval every 2 years. Exclusion code Q142A. Again, not that many exclusions, but if they've had a colonoscopy, and again, for the colonoscopy and to bill the exclusion code, you have to bill it every single year. Unfortunately, with the ministry, even though they know it's they're not eligible within another 10 years, you have to bill the exclusion code every single year in order to make sure that they keep themselves off of the roster within that category. Some of the challenges, again, is the stigma of doing the testing. People don't want it. Again, cultural and religious barriers as well. It's become tougher and tougher to get this bonus category, and physicians are working hard. They're doing what they need to do. And this, again, stems back to if you've asked them numerous times and you have documentation and they really do not want it, let's remove them from the category altogether. So some of the logistics that go behind calculating. So we want to calculate their screening levels. What do we have to do? So we're using the reports that are issued twice a year. In April, you're going to get the full report, and in October, you're going to get the midway report. So right now, we're looking at the April report. Actually came a little bit later this year. Most people got it actually beginning of May. But it's going to list all the patients in each category and whether or not they've actually received the service or not. That's what it looks like. Unfortunately, it still is coming by paper. Some of you may, in the next little while, hopefully, once the ministry gets their act together, get it electronically. But for now, it's still coming by paper. And what we're going to do to calculate the screening levels. So we're going to take the number of patients screened. We're going to divide it by the number of patients in the target population, taking away the patients that are excluded for various reasons. Multiply that by 100, and you're going to get your screening level percentage. So with some numbers here, so we have 1,100 patients within the category. We have 750 that were screened, so we divide 750 by 1,100 minus the 100 that are excluded for various reasons, and you're going to get down to 1,000. So multiply that by 100, and you're going to get your 75%. So 750 divided by 1,000 times 100, 75%. And that's what you're going to do for each of the 5 categories. What are you going to do after you calculate? So now you're going to submit the appropriate billing code for the screening level within that category. So each of the categories has their own percentage levels, and each percentage level has a different code that needs to be billed. So you're going to have 5 codes that you're going to need to bill on this round. You're going to pick one from the influenza, one from the pap smear, one from the mammogram, one from the childhood immunizations, and one from the colorectal screening. If you've received top level percentages in each of them, you find the top level, so influenza 80%, Q104A, etc. down the line, and you're going to submit that through your billing system. You have until September 2016. However, I do recommend that you do this as soon as possible because you never know what's going to happen. We've had instances where physicians have waited to the last minute, something goes wrong, all of a sudden you're beyond the deadline, and now we have to go through a whole process of trying to retroactively bill it and get the ministry to approve it. It's a lot of time, a lot of wasted hours, and if you can do it sooner rather than later, I highly recommend doing that. Once you do submit, on the next RA, you're going to look to see your preventive care bonus accumulations and payment. It'll say on the current month that you have actually gotten paid, and then we know that you got paid and everything is good. If you've submitted it and a month or two go by and you do not see anything, please do let us know, and we were happy to help you and figure out what's going on. Some of the shortfalls that are coming within this whole program, again, services provided are not directly billed. Again, flu shots going through a pharmacist, mammograms performed at the OBSP. You don't always know that they've gotten them done or not, and that's a flaw because we hope that if they are receiving the service that the ministry will know about it, that they in turn let you know about it. Unfortunately, that's not happening, and that's where some of the shortfalls come in. If they're not being billed properly as well, for whatever reason, you add on the wrong billing code to a visit and you think it's being tracked or billed and it's not, and then all of a sudden you get the report and all of a sudden Mrs. Smith, who you thought you gave a flu shot to, doesn't have it, or Mr. Smith, you sent for the fecal occult and it didn't get tracked, it didn't get billed properly. So that's where you have to take the extra time when the report comes in to look and see. Go through the report, see who hasn't had the service done, and double check with your notes and your charts to see if they actually have had the service done, and you can manually adjust that. Some categories track automatically and some do not. Again, some of the billing codes act as tracking codes. If they don't, unfortunately, that's where you have to put in that little extra work or have the staff do that. But again, we can definitely assist in explaining and finding out the right way to go about and do that. So some of the key takeaways for today: submit your tracking codes regularly. Again, billing tracking codes as much as you can. Overdoing it is okay, obviously not on the billing codes, but tracking codes for sure. Bonuses have to be submitted by September. Please make sure they are dated March 31, 2016. Very, very important. But again, you do have until September. Sooner rather than later is obviously better. Targets attained can be built through their EMR using a mock patient. So you create a dummy patient and put it in. You can put your date of birth, your health card number, or actually leave the health card number blank, and you're good to go. Or you can submit via paper the old school way, and either one works. Higher levels can be resubmitted, so if you want to make sure you get something and then take the time to go through, you can submit the lower levels right now that you're confirmed to have received, and then once you go through and reconfirm, if there are higher levels, resubmit, and they will pay the difference. So that brings us to the end of our presentation for today. Thank you very much for taking your time to join me today. Any questions you do have, please feel free to reach out. You have my email and direct line there. We are happy to assist both you and your staff if there are any questions. So with that, again, thank you so much for joining me today, and I look forward to speaking with all of you very soon.